long does it take for phosphorus of 9 to go down when giving a binder?
If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the video so I can create more content like it.
And again, another great question, really, really complex answer. So there isn't a general expectation, recommendation, theme. It's very cat specific because it's very disease state specific. So the reason phosphorus tends to rise in cats with kidney disease is the kidneys aren't processing it like they're supposed to. So if it's not getting excreted like it should, it's building up in the body instead. And there isn't one perfect phosphorus binder for each cat either. There's people who swear by one and people who swear by the other, and there's a bunch of different options. But the part of the problem with this is that we can absolutely flush phosphorus down using IV fluids. So when they're hospitalized, that's one of the things that one of our goals while they're on IV fluids to flush that phosphorus down, because not only does it make the cat feel crummy, and not only does it suppress their appetite, but it causes a whole bunch of other metabolic derangements. So we can sometimes get that number down relatively quickly in a cat that's hospitalized on IV fluids. If we're trying to do it with sub-Q fluids, that can take a little bit longer sometimes. If we're doing it with a phosphorus binder, that also depends on what is the cat eating, how much is the cat eating, and what phosphorus binder are you using, because the value that we're getting on blood work for the phosphorus is the blood level of phosphorus, and that's not even that accurate, but it's the blood level. It's not the GI level. So when we're using a phosphorus binder, you are giving it orally, hopefully with the food, because you're binding the phosphorus in the food in that GI tract. So it's not like it's pulling stuff out of the bloodstream, which is another reason you will often see that cats that are hospitalized in clinic on IV fluids for like an initial bout of acute kidney disease or something like that aren't necessarily started on phosphorus binders right away, because if they're not eating, it's doing us absolutely no good. We're just stressing them out by giving them something else orally. It has to go along with the food that they're eating, because it's binding phosphorus in the guts. It's not pulling it out of the bloodstream. So this number may come down fairly quickly if we've got a cat on IV fluids. If we're relying solely on what's in the gut and using a phosphorus binder, it may take longer. And if this is a cat that's in a really advanced stage of kidney disease, we may not be able to get that number to come down no matter what we do. So there's a lot of finesse to that question. The other ultimate question, and this goes for anything CKD related, is how is the cat doing? You know, if that phosphorus level is 9, but the cat is acting 100% normal, eating and stable otherwise, yes, we want it to come down, but I also wouldn't panic over it. One of my overarching themes is treat the cat, not the numbers. Yes, the numbers can guide our treatments, but I have seen some cats with just horrible blood values do very, very well. And then I've seen some cats that don't have that much of an elevation that just don't do well at all. So again, it's complex. Sorry for the long explanation, but complex question in that phosphorus number may come down quickly in IV fluids. It may come quickly, with some phosphorus binders orally, depending on what the phosphorus level is in the food. It may not come down very quickly at all.